was working for a trucking company in Missoula here. It's defunct now, but anyway, it was going when I found out I had breast cancer. And I fortunately had insurance. And so I went through having mastectomy done and through my chemotherapy and everything with insurance. But shortly after I completed my physical, or my, what do they call that? Well, my treatment for cancer and all of those blood tests you have to have and all of the goofy stuff they put you through to make sure you're pure again. My husband had a stroke that paralyzed him. And I was just getting my strength back to be able to be a human again. And so he, like our friend here, is a Vietnam veteran who was in the Veterans Healthcare System. But I got him over to St. Pat's shortly after the stroke happened, but not quick enough for them to give him the shot that prevents having more strokes. So he had more strokes and ended up paralyzed. And he's still in a wheelchair today. I don't believe Randy will ever walk. But in order to take care of Randy, I couldn't find anyone that would care for him for less money than what I made. So I had to quit my job to care for Randy. And I did retire from Federal Express after 10 years of being a courier for them. So I did have that little income coming in, and I was just old enough to start drawing that. So that was $446.75 a month. So that's what we had to live on at that time until Randy could go through the system and get his Social Security. Actually, it's railroad retirement benefits. And it was a couple years into that business that I got feeling kind of badly one Sunday. It was a Mother's Day, which my father died on Mother's Day, and it made me kind of nervous when I got darn sick on Mother's Day. But I went to the emergency room at St. Pat's, and they put me through every test they could find. And of course, I was a little apprehensive, so my blood pressure flew up, and my pulse was beating like a railroad train going down a good grade, you know. And anyway, it ended up they called in a specialist. I ended up with a $1,700 bill for the emergency room. Then they wanted me to go over to the Heart Center, which is a lovely place, and I had to do the tests over there, which at the same time I was scheduled for a colonoscopy, and I'd already paid my $500 up front. So I went and had the colonoscopy done. I ended up I was pretty close to $3,000 in debt, and I wasn't able to pay the clinic back fast enough, so they turned me in for collection for the $700 I couldn't pay back to them. And it just threw me in a tailspin. And the thing of it is, I couldn't get insurance, and when I could get insurance, it was so expensive I couldn't afford it. But the thing is that we definitely need to stand up for this healthcare reform and really support it. And regardless of what I've read in the papers about Max Baucus, he is not really in the pocket of all of these insurance companies. He is serious about this support, that getting this healthcare reform through. And I hope that any of you that are here can really appreciate how hard he is working for us. And I don't know what else I could say.
No, that's fine.